Hi, my name is Kathleen Jones, and I'm taking speech at CCUA this fall in Nashville. My speech this week is an informative speech. In my speech, I did the history of hospice care. First and foremost, hospice care was first come about by a lady named Dame Sanders. In 1948, she opened her first hospice care in London called Christopher's Hospice Care. Then in 1968, she came to the United States and first introduced it to us when she did a speech at Yale. Hospice care, as we all know, or would like to know, is where nurses and doctors come into your home or a hospital or prison and take care of you because you've been diagnosed with 6 months or less to live. So when a patient's diagnosed with 6 months or less to live, hospice care comes in, and their main goal is to keep that patient comfortable and let that patient die with dignity. If they come into your home and say they're kind of helping you in a lot of pain, they're going to give you morphine, or they're going to give you some type of pain medicine constant to keep you out of pain. Then if you're diagnosed with a week or less to live, they'll start staying overnight visits instead of just coming during the day at certain times to check on you. Hospice care, there's a few ways you can tell that a patient is dying. Now on my poster, this man over here is in prison, and this family is at home, and then this one's in the hospital. And signs and symptoms of dying is they stay under a blanket because they're constantly cold and their body feels cold. Their eyes begin to daze off to where they can't really see you or hear you or anything like that. Then with hospice care, they withdraw from participation in talking with you and conversating with people because they can't really hear you. They increase their sleep. They decrease in food and liquids. Apnea, which is where they pause in breathing for a moment. They begin to see people that's already passed away and ask for them. They actually will state that he or she is dying. They will request family visits often to tie up loose ends. They get to where they have the inability to heal wounds or infections, and their body begins to swell. The active phase of dying that nurses look for towards the end to help with family and to help them cope is they look to see if they're unresponsive, have severe agitation and pain, longer periods of apnea, fluid buildup in lungs, inability to swallow, which causes them to have to just kind of syringe the pain medicine into your cheek because your cheek will absorb it. They breathe through their mouth wide open. They can't speak to you. They don't really hear you, or we don't know if they hear you, but they can't respond. They have no bowel movements. Their organs in their body begin to shut down. Their blood pressure drops dramatically, as well as their O2 sats, which is oxygen. Their skin is extremely cold to touch. They can't feel their feet or hands. They become blue in color, and finally, their jaw will completely drop. And it'll be wide open, and you can tell that they're about to pass away. And after the patient passes away, the hospice care is responsible for the family aftermath, like getting a counselor, a grief counselor, and everything in for the family to make sure that they're taken care of and that they are not okay with it, but can learn to cope with it. They help you learn to cope with it. They help you with getting the body to a funeral home, getting all the plans set up. Taking care of just that patient and their family is their main goal. And hospice care is going to make sure that you die with dignity and that you get to tie up loose ends and not feel pain and not be in pain for the remaining parts of your life. Thank you.